Okay, you can go ahead. Thank you.
Okay. Hello, everyone. It's my pleasure and my honor to welcome you today to one of our weekly online series. On behalf of the Educational Board of the Media Medical Association and the Egyptian Society of Anaesthesiology, I would like to welcome the speakers and attendees to this creative and prestigious continuous opportunity to deliver not only an up-to-date curriculum in the field of anesthesiology, critical care medicine, and pain, but also to gather unique speakers and moderators from all over the globe. This opportunity is and will remain a great and successful experience in the current and the future virtual learning, especially during the current pandemic. Today, we have a special topics in the critical care medicine with unique names in the field. I would like to welcome our first speaker, Dr. Kalliopi Megari. Dr. Megari is a postdoctoral researcher at Aristotle University of Thessaloniki, Greece. She is currently the General Secretary of the Board of Directors of Hellenic Neuropsychological Society and an adjunct lecturer at University of Lunena. Her presentation today is about the neuropsychological outcomes in cardiac surgery patients. Dr. Megari, you may start.
And thank you very much, Dr. Abdulati. I would like to thank you for the invitation. It's an honor for me. And I would like to thank Dr. Saad Mahdi for the invitation and the communication between us. So I would like to share my presentation now. My presentation is about neuropsychological outcome in cardiac surgery patients, and I will present two group of cases, patients with coronary artery disease who underwent coronary artery bypass grafting, and a patient with heart failure who underwent left ventricular assist device with stem cells implant. But before before my presentation, I would like to introduce myself, my city, and my university. I am Dr. Kalliopi Megari. I'm a postdoctoral researcher at Aristotle University. I'm an adjunct lecturer at University of Ioannina in Greece, head of the Center of Creative Activities of Children with Disabilities, Municipality of Kalamaria, Thessaloniki in Greece. I work as a counseling psychologist at Prison of Thessaloniki Diavatai, the School of Second Chance. I was a research fellow at University General Hospital of Thessaloniki, AHEPA, at the Department of Cardiothoracic Surgery. I'm editor-in-chief at Journal of Psychiatry and Mental Health, and I'm a general secretary of Board of Directors and Ethics Committee member of Hellenic Neuropsychological Society. Now, let me tell you a few things about my city. Thessaloniki is the second largest city in Greece. Its nickname is the co-capital, a reference to its historical status or co-reigning city of the Eastern Roman Byzantine Empire alongside Constantinople. Thessaloniki is Greece's second major economic, industrial, commercial, and political center. It's a major transportation hub for Greece and southeastern Europe, notably through the port of Thessaloniki. The city is renowned for its festivals, events, and vibrant cultural life in general, and is considered to be Greece's cultural capital. This is my city. It's a beautiful city. You should come after things with COVID-19 are over. And here are the monuments, the historical monuments. And now let me tell you a few things about my university. Aristotle University of Thessaloniki is the largest university in Greece. The main campus is located in the center of the city of Thessaloniki and covers an area of about 33.4 hectares. It comprises 10 faculties, which consist of 40 schools and one single school faculty. Aristotle University strengthens our role in the European and international knowledge community by building upon collective and personal academic achievements, enhances our visibility among the traditionally prestigious academic institutions all over the world by establishing long-term cooperation schemes at research, education, and training level. Here is Aristotle University of Thessaloniki. And now the School of Psychology. Founded in 1993, the School of Psychology has a worldwide reputation for high-quality teaching and research. The school also provides students with theoretical and practical training directly related to their main field of study, aiming to prepare them for further study in disciplines related to psychology. The School of Psychology consists of 3 departments which coordinate teaching and research, implementing programs and activities that help faculty members fulfill the multiple roles: experimental and cognitive psychology, developmental and educational psychology, and social and clinical psychology. Offers BA Honors, Master of Science, and PhD degrees as part of its undergraduate and graduate studies program. This is the School of Psychology, and this is Anaesthesiology University General Hospital, that is a reference hospital for COVID-19 patients. And this is the hospital that I test the patients. And here is me working in the Department of Cardiothoracic Surgery. And now my research. Post-operative cognitive dysfunction is characterized by impairment in attention, recognition, orientation, memory, and learning following surgery. Results in increased morbidity and mortality, prolonged hospitalization, increased healthcare costs, and may have an adverse impact on social functioning and quality of life. Neuropsychometric tests are needed to detect and quantify subtle POCD. While its incidence depends on type of surgery, patient's age, method of detection, preoperative level of education, coexisting disease, and preoperative cognitive performance. The incidence of POCD following cardiac surgery can be detected in up to 80% of patients during the hospital stay and is still present in as many as 42% 3 to 5 years later. Following non-cardiac surgery appears to be much lower. Short-term incidence after general surgery is 25.8%, while its longer-term incidence is 9.9% at 3 months and 1% at 2 years. Sorry, I have a technical problem. I must share my screen once more. So sorry. Here. Coronary artery bypass grafting is a surgical procedure for the treatment of coronary artery disease.
Would you slideshow, please? Slideshow.
Okay, sorry. Okay. Provides complete revascularization, has a low mortality rate, but has side effects such as permanent vascular cerebral stroke, systemic inflammation, renal and pulmonary complications that all have adverse impact on cognitive functions. Now, let me present the cases of patients with coronary artery bypass grafting. This is the publication we have with anesthesiologists and cardiac surgeons from Anaesthesiology University General Hospital. And our study, we examined whether patients undergoing coronary artery bypass grafting with the MEX system exhibited post-operative cognitive decline to a lesser extent than patients undergoing coronary artery bypass grafting with the KEX system. Our method, neurocognitive evaluations. The participants were 60 patients, 29 operated on MEX system, and 31 operated on KEX system, 31 tested before surgery, prior to discharge, and at 3-month follow-up. We used alternative forms of tests. We had an assessment of anxiety, depression, positive and negative mood, as neuropsychological assessment may be influenced by a patient's mood state. And this is the MEAC systems of AHEPA University General Hospital. And this is the neurocognitive test battery that we have used. We assess a broad range of cognitive functions, as you can see, as well as emotions. The results, we conducted 2x3 ANOVA mixed design. No statistically significant differences were observed between the two study groups in age and years of education, any of the preoperative cognitive domains, mood, anxiety, and depression variables, and medical variables such as CPP time, number of drafts, and intensive care unit stay. As you can see, this is the performance. This graph shows the performance of the two study groups. As you can see, the two study groups have almost the same performance before surgery, but after surgery, the KEC group has decreased performance compared to the MEAC group. And 3 months after surgery, the MEAC group has very increased performance, exceeds the preoperative level, but KEC group stays the same as the second time point, decreased performance. And the same profile you can see on attention, executive functions. Now, the percentage of post-operative cognitive dysfunction between the two study groups. As you can see, the MEAC group has 41% prior to discharge and 21% 3 months after surgery, while the KEC group shows 65% prior to discharge and 71% 3 months after surgery. Now, our conclusions. What do we have to say about these two study groups? The MEAC group, their follow-up performance exceeded the preoperative neurocognitive levels. They showed less overall post-operative cognitive dysfunction in these patients, while the KEC group didn't reach preoperative neurocognitive levels immediately and 3 months after surgery. They show cognitive decline on most neuropsychological domains. Our findings suggest that the use of MEAC systems may be beneficial for the neurocognitive outcome of the patients. Cognitive stability plays a significant role in quality of life and daily activities, especially in heart surgery elderly patients. And now I will present you the second case of patients, the left ventricular assist device. I undergone operation with left ventricular assist device. Heart failure is a condition that the cardiac output is insufficient to meet the needs of the body. And ischemic cardiomyopathy is a major cause of heart failure. Causes dysfunction of the heart muscle and has previously been associated with neurocognitive deficits, among others. The left ventricular assist devices are used successfully in treating patients with heart failure as a bridge to transplant and as destination therapy. That means that it's a permanent therapy condition for the patient. LVADs stem cells implant is a worldwide innovation in heart surgery and was conducted at AHEPA Hospital that is affiliated with Aristotle University. This procedure in end-stage ischemic heart failure enhances myocardial reperfusion. And this is the LVADs. As you can see, this is the device that is inside the body of the patient, inside his heart. And these are the batteries that the patient must carry always with him. This is the stem cells injection. Stem cells are injected intramyocardially. And this is a photograph taken from the surgical procedure. And let me present our patient. It was a case study patient. I am a 64-year-old right-handed male with 9 years of education, married with 2 adult children, worked as an accountant in private sector. He was retired by the time of the evaluation. He was a patient with end-stage ischemic cardiomyopathy undergoing LVAD and stem cells implant, followed over the course of 1 year after surgery to determine potential for improvement in cognition, underwent a comprehensive neuropsychological assessment, and concurrent counseling sessions with patient and family members. The neurocognitive assessment, the patient was assessed before surgery at 1, 6, and 12-month follow-up. We used alternative forms of neuropsychological tests. We had an assessment of anxiety, depression, positive and negative mood, as well as quality of life, because the performance on neuropsychological tests may be influenced by the patient's mood state. And here is the neurocognitive test battery that we have used. As you can see, we had a very broad assessment of all cognitive functions, and depression, positive, negative mood, anxiety, and quality of life. Cognitive decline was defined as a decrease of 1 standard deviation or more in performance on 1 or more of the neuropsychological tests relative to Greek normative data of individuals in the same age group and educational level as the patient. We compared the performance of the same patient at 4 time points. And here is the performance of our patient compared to the normative data. As you can see, before surgery, his performance is almost identical to the average, to the comparative, to the Greek normative data. But 1 month after surgery, his performance is decreasing compared to the average range, and is increasing 6 months after surgery. That stays at 1 year follow-up. The same pattern, almost the same pattern, can be found in attention. The patient's performance before surgery is almost the same with the Greek normative data, but after surgery there is a decreased performance that is even more decreased 6 months after surgery. But at 1 year follow-up, the patient performance stays within the preoperative level of evaluation. On semantic verbal fluency, executive functions, that means it's executive function test, his performance was almost identical with the Greek normative data, but after surgery, his performance is decreasing. Stays decreased at 6 months follow-up, but at 1 year follow-up, his performance is decreased more than 1 standard deviation. And what do we have to say about this patient? Patient's performance was in the average range, with no evidence of decline on the 3 follow-up evaluations on executive functions, visual spatial perception, visual organization, attention, picture naming, working memory, mood scales, and quality of life. Post-operative cognitive decline at 6 months after surgery of this patient reversed over time. Overall, improvements from follow-up at 1 month to follow-up at 6 months occurred on 50% of the variable examined. Patient's performance returned to the average and high average rates 12 months after surgery. And what do we have to recommend for these patients, for these study groups, coronary artery bypass grafting patients and LVAD with and stem cells implant patient. Psychoeducational programs are necessary, along with cognitive rehabilitation program focused on specific difficulties to develop new strategies for daily activities. Psychoeducational programs are necessary both for patient and his family too. For management of negative emotions regarding device noise, psychological counseling for patient and family together or separately. And the important key points were that the particular patient with the LVADs and stem cell implant has many counseling sessions before surgery and concurrent session with family and family members, because counseling facilitates neuropsychological assessment. And phrase what Ala Badley had told about memory, we say that perhaps the best way to appreciate the importance of cognitive system is to consider what it would be like to live without it, as cognitive system is not a single organ like the heart or liver, but an alliance of systems that work together, allowing us to learn from the past and predict the future. Thank you for your attention.
Thank you, Dr. Kalliopi, for this nice presentation. And look to the chat box to look for any questions. There's no questions at the moment here. And you have any specific score to assess those patients, Dr. Kalliopi, in the intensive care after on a regular basis after they get out of from theater and get extubated and those kinds of things?
I can't hear you very well. Can you repeat the question, please?
The question is about, do you have a scoring system to assess this neuropsychological disturbances that happen to those patients in the ICU on a regular basis? So you know how they shift from the baseline, and you measure it at the baseline before surgery as well?
Yes, our baseline is the evaluation, the assessment before surgery, and we have data of Greek normative data of patients with a wide range of educational level and age level, and we compare the pre-surgical performance of the patient and the post-surgical performance along with the comparative data of healthy patients, of healthy adults.
Okay. Thank you. Is there any more questions? Okay. So we'll go for the thank you.